Now, the National Council of Provinces yesterday voted in favour of the National Health Insurance Bill. The bill was already adopted by the National Assembly before being referred to the NCOP. Now, last week, the Select Committee on Health and Social Services resolved to pass the contentious healthcare bill without any amendments. Parliament says that the bill seeks to ensure that every South African will have the right to access comprehensive healthcare services free of charge at the point of care at accredited healthcare facilities. Now, one of the key purposes of the bill is to establish a national health insurance fund and to set out its powers, functions and governance structures. The chairperson of the South African Medical Association, Dr. Mvuyisi Mzukwa, and chairperson of the Select Committee on Health and Social Services, Mr. Edward Joyisile Njadu, join us now virtually to have this discussion. Gentlemen, thanks so much to both of you for your time and welcome to Morning Live.
Good morning to you, Sakina, and your viewers and Mr. Njadu. Thanks for having us.
Good morning, Sakina. Good morning, Dr. Mzukwa. Thank you very much for the opportunity.
So, Dr. Mzukwa, let me start with you with regard to SAMA's views on what seems now like an inevitability, the inevitable implementation of the National Health Insurance.
Yeah, thank you so much, Sakina. I think South African Medical Association notes really with concern that the NCOP has gone and adopted this bill without really taking into consideration the issues that we have raised, as the South African Medical Association, representing doctors from the public sector and the private sector. And we, as you know, we've been part of the bill since the green paper, the white paper, the policy, the bill itself, and we always consistently made inputs. We are, even though we are in support of the broader principle of universal health coverage, but we do not believe that the NHI is capable of delivering on those, based on the fact that, one, as you know, our hospitals are in a dire state. They are dilapidated. There's a dire shortages of staff. It was admitted to by the minister in parliament as well. It's not coming from me. But also you've got issues of leadership and governance that were tabled by the former health ombuds, Professor William Makgoba, and many other issues that have been raised. And we also believe that it's a curative approach. It neglects issues of prevention and promotion of good healthcare, and we don't think that in that regard it is going to be assisting, to deal with the issues in the country. Let me quickly make an example, Sakina. If you look at the water challenges that we have, you will recall that in the Eastern Cape, many villages there are without water for more than 300 years. And you don't believe that without sorting out those issues, you are going to just come up with something that is going to buy healthcare services. Let me remind you again, this bill, it establishes a fund that is going to buy services from service providers, clinics, hospitals, doctors, private sector. But it does not hire the shortage, the healthcare practitioners. It's not going to build hospitals. It's not going to deal with the issues of leadership. And we've been told in no uncertain terms by the Minister of Finance that they do not have money for the NHI.
So let me come to you, Mr. Njadu. Have you taken all of these concerns into consideration?
Thank you very much, Sakina. Thank you very much to Dr. Mzukwa. Sakina, from the National Council of Provinces perspective, is that this matter is not a new matter in terms of the National Health Insurance. It's a matter that is coming for a very long time. And this matter was tabled to the National Assembly, and the National Assembly referred it to the National Council of Provinces, which, as the National Council of Provinces, we immediately referred the bill to provinces, and provinces then give us their schedules in terms of public hearings. Because what is very important, Sakina, is that when you make law, is to ensure public participation. And in this case, as the NCOP, we have extensively went out to all the districts across all 9 provinces, where we had public hearings to listen to the people. So the people have spoken, and they have raised their interest and support for the National Health Insurance Bill. So in terms of listening we receive submissions from stakeholders, and we also receive plus minus 25,000 individual submissions, which all those submissions, the National Department of Health, we invited them on the 31st of October, and also on the 7th of November, and also on the 9th of November, whereby the committee have extensive receive extensive response from the department. The department have explained in terms of the matters that was raised by the stakeholders, the matters that was raised by the submissions that we have received. So as the NCOP, we believe that we have listened through the department as to what are the concerns, and all these matters are matters that was responded by the department.
Great stuff. So I'm going to ask you to then help us understand all of those matters as they were understood, and how the department then actually addresses these. So if the NHI is about free access to quality healthcare for every South African, Mr. Njadu, what will the difference be between facilities right now and facilities under NHI? Let's focus on the government-run facilities specifically.
Yeah, first and foremost, Sakina, is that a legislative, a bill, is not an implementation plan. As government here, our role is to ensure that the state must take reasonable legislative and other measures within its available resources to adhere and achieve the progressive realization of each of these rights. Meaning, health is a right, and then as government, we are making sure that we every citizen in South Africa have a right to an access of quality of health, and to address also the inequality which is there. Because in terms of the current system, the two spheres of the private and the private sector and the public sector, is that there's inequality. People cannot afford.
Yeah.
I mean,
Mr.
Yes.
Njadu, I think that is exactly my question. So how exactly is it going to differ? Because what people are receiving now is, of course, a far cry from what most South Africans are, supposed to receive if we get this thing right. So how is that going to be addressed? And I hear what you say about being on the legislative side of things. However, you did say that the Department of Health did speak to you. They did explain some of these things. And that's where I was coming from in terms of what the explanation may be.
Yeah. Let me start with the concerns raised by those who are not supporting the bill. The concerns raised by those who are not supporting, the concern about where the government don't have funds, they are concerned about the hospitals, their concerns about the single payer. Those matters are matters that will be addressed through the regulations, because the bill will be dealing with regulations, because each and every matter will be dealt with through regulations. So the funding matter is to refer to the white paper and the green paper that was established 12 years ago in terms of cost of this of the NHI. that was calculated through the white paper and the policy which is there in terms of how government will be dealing in terms of resourcing this process. It will not be a once-off process. It will be in phases, implemented in phases. So those regulations will speak to how the implementation phase will take place. So it will not be today and everything will be dealt with on one day. It will be a phasing process where it will be phased in over a period of time.
So, of course, those answers, I suppose we will get to at some point, because it's not coming through very clearly at the moment, because even as far as funding is concerned, there still needs to be explanation to the general public about how exactly it's going to be funded, because raising taxes, I would imagine, is not an option at this stage for this, because taxpayers are already buckling. But I want to ask you, Dr. Mzukwa, because I don't think overall people are opposed to this in principle, because there does seem to be great support in the bill's stated objective of universal healthcare coverage for all South Africans. But as far as the role of medical schemes go, Dr. Mzukwa, how is this going to impact that?
Well, Sakina, I think you're asking the wrong person, because I represent practitioners, not really the funding industry. But like you said, I mean, it is going to be impacted in terms of, we have seen, for example, that with the single purchaser and a single payer approach, it's not practiced anywhere in the world. I mean, you go to the countries that they like, for example, the UK and many other countries, it's not the approach that is being used there. So I'm not sure how they are going to handle that, because especially because, Sakina, we have a government that is good at policy level, but with implementation, there is nothing that happens on the ground. I'll quote, for example, the human resource for health policy that is gathering dust there. It's supposed to be implemented, but it's gathering dust. There's many others that are gathering dust that were researched and put there, out of the public eye. So that's one thing. But the other thing is, we are, if we're talking about also the consultations, Sakina, I think we need to go back to that. The consultations that Mr. Njadu is talking about. We're talking about, the current government or governing party gathering its supporters in all the provinces, and making sure that the people that are there, their members are populating those gatherings, and they just a yes man approach in their contributions. Here we're talking about experts, not only SAMA, many others, many stakeholders who are in the healthcare system who have raised concerns, but there's, it doesn't look like this thing has been attended to, including the issue of funding that was raised by the funding industry. I think the funding industry will be better placed, to respond to your question, Sakina.
And it is an important one in terms of how all of this is going to play out. We're out of time, but Mr. Njadu, very quickly, is the country ready for NHI's implementation in terms of infrastructure, in terms of human resources, funding, looking at where we find ourselves right now?
Yeah, thank you very much, Sakina. The country is ready. The country is ready, and this, as I've said, is not a once-off process. It will be implementing over phases, and that way the country is ready for that implementation phase. Okay. Secondly, the yes man is no. There is no yes man. You can go to all the districts across all 9 provinces. People came to public hearings and they have said, people have spoken, so there was no yes man. Lastly, Sakina, is that this exercise of NHI, this same committee went to South Korea. It's working. It's working for the people of South Korea. And ever. It's not a South African practice. It's an international.
Comparing apples with apples.
Okay, I'll tell you what, gentlemen, I know we have not exhausted this, not by any stretch of the imagination. So what we will do, and I'm hoping our executive producer and senior producer are listening, maybe we need to come back to this with, a broader
Definitely.
panel and have a more discursive discussion. But thanks so much to the chairperson of the South African Medical Association, Dr. Mvuyisi Mzukwa, as well as Mr. Njadu there, and they speaking to us about NHI.